Dr. Shluper, let's talk about broken teeth. Does the tooth always need to come out? Is the root always damaged? There's lots of mystery about it, and that once it's broken, the root is damaged, it needs to come out, it needs a crown, it needs all kinds of things. Anyway, lots of people have broken teeth. Tell us the options to fix it, especially with your philosophy, where preserving is in your utmost forefront of thoughts. So tell us about what we can do with a broken tooth.
Yes, people come into the office with broken teeth, and their first thought is to remove the remnants of the tooth. Would it be a small root? Would it be a bigger root? I always try to explain them that it's not necessary to remove the broken root. You still can restore a nice crown, to rebuild the tooth into a nice tooth with the proper treatment. I know a man that he lost most of his teeth. All he had is some broken root tips. And he was a bad candidate for implants. He didn't have enough bone heights. What we did, we built up over those root tips, as small as they were. We built up a nice bridge, and he's working with that years and happy. Does not require much other treatment.
Well, so even if the tooth is broken pretty much at the level of the bone, you say you can still put a crown on it without an implant?
Yes, you can. Yes, you can. And it would be much healthier than having an implant.
Because, as you said, an implant is a foreign body. A foreign body creates antibodies, they get created not necessarily. Well, they get maybe created in where the foreign body is in it, like the titanium implant. But in any case, a foreign body is simply something which attacks the kidney.
It is, yes, it is, and it's much more conservative. And often much less expensive.
Right. But it's something I haven't heard a lot about it. It's not. Is it because it takes more work? It takes more artistic work. Do you come from a background of training where, again, coming from a mechanical area, that there are some engineers. They can make out of nothing something. Or in cooking, some nice, wonderful housewife, she looks in the refrigerator, there's basically nothing in it, but an hour later, for purpose 20 minutes later, there's a hell of a meal on the table. And some other chefs or cooks, they couldn't cook if there was just one spice missing. They go, oh, whoa, cannot cook anymore. And so are you such a guy? Are you somebody like who just kind of like, kind of can mold the tooth up from nothing or so?
Yeah, I always think what I would do if I were the patient in the same situation. Would I try to save the remnants of the tooth, or would I pull it out and maybe have an implant? I would go for preserving the tooth, preserving the remnants, even if it's a small root tip. It still, in the worst case, will prevent the bone from shrinking.
Right. And that is worth a lot, because that has to do with looks and with all kinds of stuff. So, tell me again, why do most, or for all purpose maybe none of the dentists do that? I'm sure there are some out there, but why is it not most of us know that if our tooth is majorly broken, it's gone, finished, done, over, dead, kaput.
Yes, that's a common conception.
Misconception.
A common misconception.
Yeah.